Constituent in the 2nd Congressional District. I am a constituent of Congressman Todd Akin.
Sorry.
Well, I'll let that one pass. We're here today, though, because many of us who are constituents have called Congressman Akin's office and asked for a meeting with him. Many of you in the room have written him letters asking him if we could have a meeting with him. Some of you have gone to his office on more than one occasion, 3 or 4, asked if we could have a meeting for him. And we've never gotten a response. So the group who has organized this had a letter delivered to his office inviting him to our town hall meeting. Obviously, he didn't accept that invitation. As a matter of fact, while we were making plans, he put out, rather than responding to us, he put out a press release, which we have gotten hold of. And I'm going to share that with you. It says that it's his statement regarding the Union Hall rally and protest. I think that's us. St. Louis, Missouri. Congressman Todd Akin's office released the following statement regarding planned protests at his office, which will be staged today by Jobs with Justice at the United Food and Commercial 655 Union Hall. Congressman Todd Akin, who regularly meets with many constituents, groups, and business owners, agrees that jobs and the security of American families should be the #1 priority in Washington, which is why he has worked assiduously to reduce wasteful government spending and eliminate needless and burdensome regulations on job creators. Further, Congressman Akin understands that the best way for the government to help create jobs is to get out of the way of small business, entrepreneurs, and industry who are in the business of creating them. So he has not come to us, and what I'd like to know is, where is he? They are on recess. He is in the state of Missouri, and why isn't he here talking with his constituents, which is whom we are? And I would like to ask Congressman Todd Akin, whose side are you on? Are you on the side of the working people? Are you on the side of seniors? Are you on the side of those who need Medicare and Medicaid? Are you on the side of those children in this state that go to bed hungry? 1 out of 4? Are you on the side of those who are out of jobs? Whose side are you on? He's not coming to us. We're going to go to his office. Can I answer?
What do you want? Now! What do you want? Good job! Hands off Social Security! Hands off Social Security! Hands off Social Security!
We rely on Social Security, and I mean Social Security. As you have probably heard, we don't like the way the term entitlement is used, with the implication that we are receiving a hand out,
That's right.
not a hand up.
That's right.
Over 51 million Americans receive Social Security. People who are disabled, people who are poor. And many of us, including most of the women in my group, are healthy, have modest savings, and with our Social Security funds, we can put money into the economy by making purchases, going to the occasional movie, and out to dinner. Without Social Security, we would not put this money back into the economy. And for others, like a good friend of mine who worked all her life at a very low-wage job, Social Security provides about 95% of her income. Hardly enough to pay her bills. And then we talk about privatizing Social Security. Over the last 5 years, my husband and I had a 0.05% return on our investments.
That's right.
But it's slightly better than the Dow Jones return of 0.01%. The S&P 500 had minus 1.85% return over 5 years. I don't think I want Wall Street handling my retirement funds. And it's very disturbing to hear comments that changes in Social Security would not affect those of us who are currently receiving funds, and that it would only affect those 50 and under. That is not reassuring. We care about our children. Our children are working in an age where the phrase defined benefits brings forth a confused stare. Employers provide fewer benefits and lower wages. Our son hasn't had a raise in 6 years. His 13-year-old daughters still require supplies for school and clothing. His car gets older, gas costs more. Do you think that he's able to put money aside for retirement? And do you think with the stress of daily living that he should self-invest his funds? I don't think so. Representative Akin, we want to know whose side are you on? This important program is essential for our security and for the stability of our society. Thank you.
Thank you, Mary. $587 a month. That's all I get. $587 a month. I'm 72 years old.
Remember, we're out in the hot sun
And I pay
because
you.
Congressman Akin wouldn't meet with us.
He doesn't care. He could care
Okay,
less.
I'm sorry, I have to learn
He
this.
could care less.
Make sure as people come around with the Post-it notes, you let him know, ask his questions. We care about Social Security, Medicare, Medicaid, jobs. And now, Kirsten Dunnan is going to step forward. She is Policy Director of Paraquat. And she's going to explain how important Medicaid is to more than 1 million Missourians.
Hi, I'm Kirsten Dunham, and I'm here to say that Medicaid matters. It matters to more than 1 million Missourians. Women, children, people with disabilities, and seniors. To my friends, Medicaid means independence and freedom. Medicaid pays for personal attendance services that help people get up in the morning, get ready to go to work, to go to school, and to participate in their community. And I want to ask Congressman Akin, would he rather live in his own home, live with his family, or would he rather be forced into a nursing home? I think everyone wants the services and supports to be able to live with their own families in their community, and that's what Medicaid means for many people with disabilities and seniors. It also pays for durable medical equipment like scooters and wheelchairs. And if you can imagine, some wheelchairs cost as much as a car. And do you think somebody living on $787 a month can afford to pay for that out of pocket? No. Yet it is so valuable because it gives people the independence and mobility to be able to get up, go to work, and go to school. Medicaid matters for our community. We know that kids that are healthy do better in school. We all do better in our jobs when we're healthy. Personal attendance services cost much less than nursing homes and institutions. Adequate and quality mental health services can prevent hospitalizations and even prison costs. And we all benefit when people have health care coverage and do not have to rely on emergency rooms for their health care. We believe in independence and freedom, and if we want a community that supports families, that gives people choice and opportunity to go to work and to school, and communities that promote health and well-being, Medicaid must be protected. Cuts to Medicaid will harm our families, our friends, and our community. So let's tell Todd Akin to protect Medicaid, and Medicaid matters to Missouri.
Yes.